another episode of Pelvic Confessions. I am Dr. Kari Howe, joined by my co-host, Dr. Jean Shirakabrad.
On this show, we have conversations about women's health and pelvic health that women don't often have, but really should have.
Yep, each week we will present our topics as confessions that either women have shared with me in the clinic or some small tidbits, some confessions that I have for women in general.
So this is, we're closing out February.
Yes.
We have March right around the corner, which is
Mhm.
crazy. The heart mugs are still here.
They're still here.
They're
One
still
more
here.
week.
One more week. They they'll be sidestepping, I'm guessing, for something green next month. Spoiler alert.
Tune in.
Tune in for the mug reveal. We've been expanding the show a little bit. I think it makes sense. Last time we talked about some of your favorite exercises
Mhm.
to deal with painful intercourse.
Yep.
So this week, the confession is also kind of you sharing
Yep.
something that you share with your ladies, a confession of sorts,
Mhm.
your private secret, clinician secret.
Right.
I think this is important. Not to be clear, the confession today is Kari is going to share
Mhm.
some of her favorite products that she
Yes.
uses.
Yep,
Right?
for treating painful
For
intercourse.
treating painful intercourse.
Yep.
The disclaimer I want to make is that we're not promoting these products. We don't get any money from these products.
Right.
These are purely because you like them as a
Yes.
clinician and they're beneficial.
Yep.
So to me, products are great because they can be a segue between the body adjusting to results, right? Because sometimes it takes time
Sure.
to make those changes, but some of these can be that
Yeah.
in between.
Yep.
So let's kick it off.
Yeah.
You want to start off with your first one?
We'll start off. So as Jean mentioned, these are just general recommendations here. Obviously, this is not coming as medical advice, and it really just depends on the individual that I have in terms of making recommendations for these. But we'll start off with a couple of tools that we use, moisturizers and lubricants. So when we're dealing with painful intercourse, we have to keep in mind that those vulvar tissues in your vagina can become dry. And the one of the basic recommendations that we make is coconut oil. So using some type of moisturizer for those tissues. I tell my women in the clinic, we think about putting lotion on the rest of our body every day, but we fail to recognize that those tissues down there
Mm.
can be dehydrated. And so, a simple way to help resolve that is after you're done showering, grab some coconut oil, put it on your finger, and insert. You can insert a little bit into the vaginal canal and around the vulvar tissues.
Now, moisturizer is not the same thing as lubricant,
Correct.
right?
Yep.
There's a difference.
There is a difference. So, a lubricant, we are using that should be applied during the time of an activity,
Mm.
right? So typically we're talking about vaginal penetration of some kind, whether it's with a therapeutic device or for sexual intercourse.
Sure.
So lubricant is kind of live time action. A moisturizer is just kind of maintenance or upkeep that you can apply once a day. Um, this here is my bottle of coconut oil that I use to remove my makeup, so it's looking a little gunky. I always tell my women, make sure you have your own separate can of coconut oil to use specifically for that, not running into your cupboard and sharing the same coconut oil that you use for cooking. Just because we want to make sure we're taking
Somewhat
hygiene
sanitary.
into account. But it can be coconut oil. That's typically what I recommend. Vitamin E oil also works as well. They do make over-the-counter vaginal moisturizers. I think Replens is a big name that you can go to a drugstore and pick up, but most people have coconut oil laying around. I will say with a disclaimer though, of if women have a history of infection, yeast infections, etc., of frequent infections, that's typically not advised. So again, you need to consult with your healthcare provider as to whether or not it's I don't want to say safe for you,
Sure.
but appropriate for you
Yeah.
to start with moisturizing your vagina and your vulva.
So like once a day
Yeah,
is
once a
pretty,
day. Yep,
just a little bit goes a long way.
little bit goes a long way. Yep.
All right. So that's maintenance.
Yes.
And you alluded to lubricants
Yes.
being more of
Yeah.
in the moment
Yep.
to use
Yep.
for friction, I'm
Correct.
assuming.
Yep. So this is really about increasing comfort and pleasure. And
Hmm.
so a lubricant, again, is going to be applied just before the activity. The one that we recommend is called Slippery Stuff. I have used it for all my years of treating. It's pretty thick.
Yeah.
um,
Yeah, you could see.
I've never had any clients ever had any reaction to it. They all love it. Why we promote it
It's
is
pretty
you can
thick.
see it's thick, right?
Yeah.
It has a cushion to it.
It's definitely
And
not like moisturizer. It's a
no,
very
no.
different.
Yep, it has a cushion, a plumpness to
Yeah.
it. It's water based, it's glycerin free, it's paraben free. You have to be really cautious with lubrication. Typically, the KY jellies and the Astroglides and kind of some of the name brand generic types tend to have a lot of chemicals in them,
Mm,
and that can be really harsh to the vaginal tissues.
the irritants.
Yep, they can actually serve as an irritant. You think that you're applying it to help decrease friction, but then there's really irritants to
Yeah.
those
I'm
tissues.
sure that happens to a lot of women
Yes.
because
Yep.
they might get a lubricant and
Yep.
they get the most popular lubricant because obviously it has to be good if it's so
Correct.
popular.
Yep. A lot of them even have alcohols in them, which can be drying
Drying
to
out
the
even more.
tissues. So counterproductive.
Hmm.
But again, we use the water-based, glycerin-free. It's the gel version, so that's where that kind
That's
of
why it was so.
plumpness comes to. Some water-based brands can be really runny
Hmm.
and messy,
Yeah.
and again, I find that that has a good consistency to it.
It dries pretty quickly though.
Yeah.
So you need to reapply
Well,
often.
good. Thank you for bringing that up. That is really the only con of using something water-based like that is
Mhm.
it can dry up quickly. And so you might need to reapply it during the activity. But outside of that, it can be used with condoms and with toys and with devices. And yeah, I think this is the tried and true staple. You can get it on Amazon. You
Yeah.
can get it right from the website.
Great.
Um, yeah.
Good to know.
Yep.
Slippery stuff. It
Slippery
was
stuff.
quite slippery. Name confirmed. All right. So what is the
Yeah.
third one? We have a box with some
Yes.
colors in here.
Yes. So these are going to be therapeutic tools or devices called vaginal dilators. So oftentimes I'm using these with my clients who have a long history of painful intercourse,
Mm.
maybe vaginismus. And what they are is they look like little tampons almost basically, and they come in a gradient of sizes starting from small to big. And how we use them is by learning to insert and allow your pelvic floor muscles and your vaginal
Mm.
tissues to relax in response to some type of penetration.
Mhm.
Um, we've talked a lot previously in our videos of how painful intercourse oftentimes is as a result of those pelvic floor muscles guarding and creating tension. When we're inserting something for sexual intercourse, those muscles need to lengthen. And if they're primed not to do that, we need to train them to maintain length
Mm.
when we're inserting. And we do it in a very graded exposure type of way. So starting off small, once we can master that, we then eventually continue to progress. Now, this is the small pack of the dilators, and they obviously come in larger
Different sizes.
sizes too. But the brand that we use is Intimate Rose, and I really love this brand because it's a medical grade silicone, and they make all sorts of different types. But what I tend to find is that the plastic dilators don't glide as well and it can create more friction and more
Mm.
discomfort. And so those have a little bit of a
Yeah,
flexibility to
there's some
them.
softness too.
Yeah, yep. And they can be, relatively comfortable with insertion and they have a little handle at the bottom to assist.
There's almost like a little slick coating. It's almost like a
Yes.
powdery
Yep.
coat to it.
Yep. It aids in that insertion. So this oftentimes will become a mainstay
Mhm.
for treatment when, like I said, we're dealing with something like vaginismus. So usually I'm getting my clients in, we're teaching them how to use them in office, teaching them how to use it then at home. And a lot of times they're working on this maybe two, three, four times a week at home.
Yeah.
and then we revisit in office.
So are these, we talk about internal pelvic care. Is this
Yes.
considered part of internal pelvic care?
It would be a piece of it.
Part of it?
Yeah. A lot of times it's going to be the client's mainstay of their own self treatment at home, right?
Hmm.
So we do a lot more in office. But yeah, and part of that treatment with this is not only allowing the women to insert it themselves, but then also how does their body respond when I insert it or versus their partner
Sure.
inserting it. And so um, you can use them in a whole host of ways depending on the client's needs.
Yeah, I could see that being as important feedback, right?
Yeah.
Of here's what happened and here's how I feel,
Yeah.
and then
Yep.
working through that from a clinical scenario.
I always tell my ladies, you have to practice something to be good at it.
Mm,
So if you're having pain with sex, we're avoiding it. We're not doing anything to help accelerate that process. And if we're not
yeah,
practicing it, how do we get better at it? How do our tissues get used to that stretch? So that's really it's a desensitization tactic. One thing I do want to state here is I hate the word vaginal dilator
hmm,
because I don't want to give off the impression that we're inserting these and they're creating a bigger opening. I'm not dilating and opening up and stretching out their
yeah,
hole to make it bigger.
yeah,
What I'm doing is desensitizing those tissues so they don't guard, right?
right,
This guarding closes up that closure and makes resistance. So we're training to keep that length as we continue to progress and increase the tissues and stretch. So it really is almost like a desensitization
yeah,
tactic rather than making their hole bigger.
yeah. That makes sense. I think that's a important qualifier to make because I'm sure there's a lot of women that will think, oh, I don't want to do that because I don't want the actual opening to be
Yeah,
bigger,
exactly.
versus this just helps your muscles
Right.
relax instead of changes, structural changes.
Correct.
Well, that's great. So
Yeah,
I'm assuming you use this in combination
correct.
with that,
Yep,
so
yep,
that's safe to use with
yep,
silicone like
yep.
that. Well, there you go. So we
Yeah.
have a range from moisturizer that can be more of a proactive
Mhm.
daily use to a lubricant that can help with the action itself
Yep.
in the moment to reduce friction, and then more of a therapeutic device to help you in the meantime to relax those muscles. Again, these products you can find from their websites on
Mhm.
Amazon. We're not advertising or
Mhm.
selling them in any way. We do not make any money off of these. So these are just our recommendations, Kari's recommendations from clinical use. If you find that these beneficials, or if you use these, or if you have ideas or suggestions for other products that you want us to test out and try out and let you know about, you could go ahead and leave us a comment below. If you're watching on YouTube, if you're watching on Facebook, you could comment below as well. You could always reach out to us via email or just message us on Instagram at Restore Pelvic PT. We do check our DMs, so do not hesitate to reach out. Hope you're following along on all our social media channels. And if you want to schedule an appointment with Dr. Kari, head over to restorepelvicpt.com and you can book an appointment right on the website. Don't have to call if you're one of those people that doesn't like having phone
Mhm.
conversations. You don't have to do it anymore. You just click a button or two and you're all set. So, as always, thanks for tuning in. We'll catch you again on the next episode of Pelvic Confessions. Cheers.
Cheers.
Bye bye, heart mugs.
Oh.